The way that cancer is screened for varies from country to country. So for example, here in the UK, there's no national screening programme for prostate cancer. There isn't. And you might wonder why that is. And the reason is that there is no one reliable screening test for it. In the United States, it's very common, or much more common, to do a blood test for prostate cancer called PSA. And it's something that's worth discussing with your doctor, but the thing about that blood test, which can be elevated if you have prostate cancer, but it can also be elevated for a whole host of other reasons, is that ethically it's not a brilliant screening test. So for example, if you don't have prostate cancer and you have the blood test and you get a high result, it will make you feel very anxious for a while, and you'll have to have lots of other tests for no good reason. So screening tests have to be put through their paces in a way. They have to sort of be socially acceptable, they have to be justifiable, and they have to be very accurate statistically. And unfortunately for prostate cancer, we haven't quite got there yet. And I think, no one wants to miss cancers. We always want to pick them up. A third of us are going to develop some form of cancer. I'm sure all of us know someone who's been affected by it. So it's in the interest of global health to make sure that we look at the things that cause it and actually sort of try and prevent cancers from developing, and trying to catch them and detect them as early as you can in the process. If there's a cancer lurking around, you want to pick it up early. And that is really what is quite exciting about what these dogs do, because in a way they are ahead of the game, in that sense. So potentially it is very exciting.